Joining us live right now is Dr. Joe Congeni, Akron Children's Hospital Sports Medicine Center, with us. And Joe, couple of things. One thing I wanted to bring up to you. I know you always come ready to go and stuff, but there was a new study, new findings on children concussions showing that experience symptoms longer than adults and too much rest may not be the best remedy. And that's an interesting study. I'm not sure if you saw that or not.
Yeah, thanks, Ray. Good to talk to you again. And I just came back. I'm loaded for bear, man. I just came back from Atlanta for a 3 or 4 day conference down there, and we talked about a lot of different things. We talked a lot about different concussion studies. That is actually not a newer study. It has been redone a couple times, but I think I might have mentioned here before a really good and a group of researchers from Buffalo started to look at this a couple of years ago, is this thing of brain rest, but taking it to the degree of what some people were calling cocoon therapy, putting them in quiet places, not stimulating the brain too long. Brain rest for 24 to 48 hours, first day or two probably makes some sense. But the sooner we get them going with subsymptomatic exercise, now there's several studies to back it up, and another one came out here in the last few weeks or months, and it was presented in Atlanta too. And it showed really even more loud and clear of what some of the earlier studies had showed. We need to, there's a lot of anxiety when these people are injured and when they're symptomatic, but we need to safely get them going on exercise. Sometimes it may need to be one-on-one with an athletic trainer or a physical therapist, walking them through the early stages of what they should be doing exercise-wise. But you are absolutely right, as usual, Ray, is early exercise is definitely being strongly recommended.
Okay, Joe, you mentioned loaded for bear this morning. What else did you bring back?
Well, I have a bunch of stuff, and it'll be coming up in the next few weeks only because I come away from those meetings, and there's so many things, and we're doing some good research. We had about 8 researchers from Akron Children's with us in Atlanta at the meeting, too. So we have a lot we're doing here. Our research institute is really beefed up and doing well. But I did want to talk, and I have once, I think, already this year, but those hardworking wrestlers, this is the time of year. The Deese tournament last weekend is usually the sign that these guys are coming down the home stretch. And a couple things about wrestlers. Hardworking group I wanted to mention. I was looking at the numbers. A lot of people are under the impression that perhaps wrestling would be dropping off or anything. It's not true. The numbers I looked at, the numbers of wrestlers statewide, locally, are staying about the same or actually even increasing some. And one area where it's definitely increasing is there are more of the year-round or club wrestlers. And the deal with the club wrestlers, it does set up a little of a two-tiered system. Some of the kids who wrestle year-round with really good instruction, wow, they're really good. And that's a tremendous advantage over the kids who only wrestle in the winter. You'll notice that when you go to some of the state meets coming up in the next few weeks. But the big deal is at this time of year, you don't want all that hard work to go down the drain and out the window with rashes. So I often talk about, and some of these things are just, they sound very straightforward, but they just aren't done. And our trainers report back to me, we have 28 trainers, report back to me it doesn't get done. So in the area of prevention, shower daily. That should make sense right after practice and every match. Number 2, this is probably the hardest one. Gear should be laundered every day. Kids don't wash their gear for weeks at a time, and of course that's going to be a certainty to start some of these infections and rashes. Number 3, we need really good mat control. The people that are assigned to cleaning the mats from blood and disinfected, critical thing. Number 4 is skin checks. This is where our trainers are wonderful, is have them look at anything that's questionable early so we can get on it early and get these things treated and get these kids so they can stay on the mat for these big matches coming up down the state tournament trail coming up. So two of the rashes that are bacterial are impetigo and staph. MRSA is one form of staph. Those are treated with antibiotics, and often once we get them on treatment, it might only be 2 to 3 days to get them cleared. The other is ringworm, and with ringworm, a fungus, often we start with topical, but this time of year often we go right to oral, by mouth meds. They're 3 to 4 days to get them cleared before they can wrestle again. And then the worst probably is herpes. The herpes infection called gladiatorum in wrestlers takes 5 days or more of treatment of oral antiviral meds. So a lot of kids take these prophylactically in the weeks coming up. They're doing it already. They're smart. But now, I might have mentioned to you last year, one of the really odd things, everything gets more complex in medicine, is what are called super infections. Many of these kids come in, they started with something simple like a staph, and now they have 2 infections going on at once, and if you treat them just for one, you may not clear them, and they may go to one of those major meets and have a rash that makes them infectious or contagious to other wrestlers, and they'll be disqualified before they even get on the mat. So we have to make sure to look at the prevention, look at the treatment. If you have one of these rashes that you're questioning about, get in this week. We can help you get in with somebody who can see you this week and get these treated so that you can wrestle down the stretch of the state tournament.
And real important is the medical side of this, Joe. I remember back when I was in school, staph infection, you kind of laughed and joked around and walked the other day and said, oh boy, that person must be dirty or whatever. Staph infection is nothing to joke about. This really can get inside the bloodstream and cause big-time problems.
Yeah, these darn things are evolving. And what used to be kind of minor strep and staph infections have evolved into some really bad, like you said, even in some situations, life-threatening. So in the very close contact of this sport, it makes it unique, and there's some good things you can do prevention-wise and good things you can do treatment-wise, so don't blow it off. Get in. Talk to your athletic trainer. Your certified athletic trainers, they're the go-to person in the school.
All right, Joe, great education, my friend, as always. Thanks for taking the time with us, my friend, and we'll catch up with you next Wednesday.
Thanks, Ray. Have a great week.
You too. Dr. Joe Congeni, Akron Children's Hospital, talking a little sports medicine with us.